Okay, we're going to go through the shoulder. These are the features that we will cover. The shoulder girdle is made up of 3 bones to attach our upper limb to the axial skeleton: the clavicle, scapula, and humerus. The view shows the anterior view, so you're seeing the subscapular surface. Notice how the lateral portion of the clavicle butts up against a structure from the scapula, while also going over another scapular structure. To better see this relationship, we'll look at the view of the top of the shoulder on the right. Notice this is the opposite view you get when you look at imaging. Imaging is looking at a person from their feet as if you're standing at the foot of a bed. This anatomy image, as is common with most anatomy diagrams, is from the opposite side, from the head looking down. Let's identify the notable features. The clavicle has a medially positioned sternal end and an acromial end that articulates with the scapula. On the scapula, the acromion is what the clavicle articulates. The other important scapular feature is the bony structure under the clavicle, the coracoid process. Additionally, let's name a few more structures on the scapula: the borders, medial and lateral, the inferior angle, and finally, the spine that runs posterior and medial from the acromion. Let's view the joint surface in the glenoid fossa outlined in purple. On the humerus, we see 2 prominent bumps, the greater tubercle and the lesser tubercle. Between the two is called the intertubercular groove, also known as the bicipital groove. We will look at the 2 most common views of the shoulder to identify the structures just reviewed: the AP shoulder on the left and the Y view on the right. First, pause this video so you can identify each of these structures on your own. Now let's do it together. Let's start with the acromial end of the clavicle. Now the scapular features: the acromion, spine, and coracoid process. Now let's find the medial and lateral borders. On a side note, the faint but distinct line of the scapular medial border can often be incorrectly attributed to a pneumothorax when evaluating a chest x-ray. This oval structure is the glenoid fossa, and we can nicely see the smooth head of the humerus facing it. Looking laterally, we can see the greater and lesser tubercles along with the intertubercular groove, which is more commonly called the bicipital groove, which we'll see shortly. The tendon for the long head of the biceps travel through here to a spot along the superior aspect of the glenoid fossa. Finally, the last 2 features I want to point out: the surgical neck and the anatomical neck. The anatomical neck is the part just behind the rounded articular surface behind the head of the humerus, while the surgical neck is below the tubercles. Here in this normal image, the head of the humerus is centered in the cavity. A posterior or anterior dislocation of the shoulder would be obvious from this view, which is why this view is ideal to determine the type of dislocation a person may have. Pause this video now to identify the listed structures on your own. At the top, we see the clavicle with its relationship with the acromion of the scapula. We also see the coracoid process underneath on the anterior side. Now look farther down on the gap between the ribs and the scapula. The scapular surface on this side against the body is the subscapular fossa. Up at the joint itself, we can see the outline of the glenoid fossa, the humeral head, and the greater tubercle. There are 2 main ligaments, the acromioclavicular and the coracoclavicular, which has 2 regions, if you want to be picky, that help connect the scapula to the clavicle. There are 3 muscles that also attach here: the short head of the biceps brachii in blue, the coracobrachialis in purple, and the pectoralis minor in green. An AC joint separation is the most common way to damage the coracoid process. On the radiograph, we can see the separation between the clavicle and the acromion of the scapula. Now look more closely above the coracoid process, and you can see a tiny bone fragment. This is an avulsion fracture where the coracoclavicular ligament tore and took some bone with it. This is an avulsion fracture where the coracoclavicular ligament, we have seen previously that the short head of the biceps brachii attaches to the coracoid process. I would also like to identify the pathway for the long head. This image beautifully shows the biceps long head traveling up through the bicipital groove or intertubercular groove to attach onto a spot just above the labrum of the glenoid, which is a connective tissue ring that deepens the shoulder socket. The image on the left is the best image I could find of this relationship, but it happens to be a diagram for a type 2 SLAP tear, where SLAP stands for superior labral anterior posterior tear or lesion. What is important is the long head of the biceps tendon is the only intracapsular tendon, meaning that it goes inside the shoulder joint capsule. Normally, tendons and ligaments are positioned outside of the capsule. Let's now address the rotator cuff muscles using this lateral view. Sits muscles. We have supraspinatus, teres minor, and subscapularis. Although this image does not show all rotator cuff muscles, it's still missing infraspinatus. I like how it depicts the attachment of the three posterior muscles to the greater tubercle, noted by a G, and anteriorly positioned subscapularis to the lesser tubercle, noted by an L. Now let's look for these tendons and muscles on MR imaging. In this sagittal view, we see tendons of 5 of the muscles we have just discussed. Note the tendons are dark while the muscles are gray color. Without looking at the muscle labels, think about how you would identify anterior and posterior on this patient. The key feature is the acromion of the scapula. That is posterior. Now you get to identify the structures listed on the right. Pause this video to find them. Let's start with the muscles. In front and behind, we see the deltoid. Along the shaft of the humerus on the anterior side, we can see the biceps brachii muscle with the triceps on the posterior aspects. Now for the tendons. At the top is supraspinatus, and posterior to that is infraspinatus, and below that is teres minor. Anteriorly, the large muscle is subscapularis, while just above would be the long head of the biceps brachii. Now let's look at the axial view. We are starting high up on the shoulder at the point where we can see the head of the humerus and the glenoid cavity. Remember, the view we have is from the foot of the patient, looking up with the patient lying on their back, face up, so anterior is the top and posterior is the bottom. First, let's find the bony structures. Head of the humerus, glenoid of the scapula, scapular spine, and a bit of the clavicle. Now let's find muscles. Deltoid is the easiest as it's the most lateral. Supraspinatus is above the scapular spine, and subscapularis is anterior to that. The bicipital groove with the biceps long tendon in it. Now the joint structures. The head of the humerus facing the glenoid fossa. With these little black triangles at the end, now noted in yellow, those are the labrum, which extends and deepens the cup or articular surface of the joint. At this level, now we're a little bit lower at the diaphysis of the humerus and the slender part of the scapula. The deltoid is still the most lateral and wraps around. The bicipital groove with the long head of the tendons here. On the anterior surface, we see the pectoralis major, and just deep to it is pectoralis minor. Coracobrachialis is just lateral to it. Finally, back to the body of the scapula, on the deep surface is subscapularis, and posterior to that is infraspinatus, as we are well below the scapular spine at this point. Shifting topics to identify arteries. These are the arteries listed. Here's an arteriogram from the left subclavian artery. Notice the catheter that injects the dye located here. The two main arteries you should recognize are the subclavian, and just past the rib, it now becomes the axillary. We will look at the main branches off the axillary next. This schematic are sections of the axillary artery based on the position of the pectoralis minor muscle. Here we can see the pectoralis minor going over the axillary artery as it attaches to the coracoid process of the scapula, where section 1 we can see to the left and section 3 we can see to right, while section 2 is just behind the muscle. Proximal to the pectoralis minor, you can find the superior thoracic artery. Behind the pectoralis minor, you can find the thoracoacromial and lateral thoracic arteries. Beyond the pectoralis minor, towards the arm, is the subscapular and branches off that, the thoracodorsal and circumflex scapular. These are noted because they will be nicely seen on an angiogram following. Here is the angiogram of the shoulder. Let's look at our diagram and label what we know so far. First, this tiny vessel here, lined by arrows, is the lateral thoracic. This is way too little to be identified on an exam, but for comparison to those in wet lab, it's long and thin and runs just outside of the rib cage. The next vessel over, and the one that's much easier to see, is the subscapular artery, as well as its branches, the thoracodorsal to the latissimus dorsi muscle, and circumflex scapular as it wraps around the lateral border of the scapula. In this diagram of the upper limb arteries, let's look for two main arteries, the brachial artery and the deep brachial artery. This is an angiogram of the upper arm, with the arm out away from the torso more than the previous diagram. See the humerus? I'll outline the ends to help you out. The really thick, large artery is the brachial artery. The deep or profunda brachii is located here. See how it goes right close to the bone. Moving on to the forearm, in this diagram of the arteries, we start with the brachial artery coming down from the humerus to the antecubital region. Then it divides into the radial artery and the ulnar artery. From the ulnar artery is a short vessel called the common interosseous artery. That then divides to the posterior interosseous, where we just see a tiny segment, and the anterior interosseous, which runs on the anterior border of the interosseous membrane. This is an arteriogram of the forearm. We see the main arteries, brachial, radial, and ulnar. Off the ulnar, we see a short common interosseous and a distinct anterior interosseous, as well as a section for the posterior interosseous. Finally, we also can see the U-turn for the radial recurrent.